Antibiotics. The choice of proper antibiotic for any disease depends on many factors. First of all, the initial diagnosis. And according to the initial diagnosis, we can suspect the organism responsible for this disease, and the antibiotic initially given should be against and effective against the causative organism. Proper samples and relevant samples of pus, urine, or sputum should be obtained for culture and sensitivity before the first dose of antibiotic is given. The change of antibiotic from one antibiotic to another depends on the clinical response and the result of culture and sensitivity. The result of culture and sensitivity is available after about 3 days. If there is satisfactory clinical response, we don't change antibiotic. We don't just change the antibiotic for the result of culture and sensitivity. If there is good clinical response and the improvement of the patient according to the initial antibiotic, don't change this antibiotic. The dose and duration of the course of antibiotic depends on what? Depends on the pathology, the severity of the pathology, the clinical and laboratory assessment. And we should put on your mind that unnecessary high dose or unnecessary prolonged use of antibiotic should be avoided to avoid toxicity of antibiotics. The toxicity and the toxic antibiotic and the costly antibiotic should be avoided as possible if equal effective substitute is existing and present. The antibiotic initially given also depends on patient factors like allergy. Allergy, the famous allergy is allergy to penicillin. And there is cross allergy to cephalosporins. Therefore, if there is any history of allergy to penicillin or cephalosporins, the two is not given because there is cross allergy between penicillin and cephalosporins. Also, renal and hepatic function is very important because the antibiotic is excreted finally through the kidney or the liver. If there is impairment of renal function or hepatic function, this may lead to toxicity of the antibiotics. Tolerance to oral intake of drug and the age of the patient. Sure, the dose and the antibiotic given for infants or children is not the same as in adults. Immunity of the patient, and in female it is very, very important to know is this female pregnant or lactating or not. There are many important factors related to antibiotic therapy in surgical practice. The most important points related to surgical practice are the following. First of all, prophylactic antibiotic. Antibiotic used for prophylaxis is preoperative antibiotic, which is administration of antibiotic before the surgical operation. And the optimum time for antibiotic before the operation is 30 to 120 minutes before the incision. If the operation is long operation and the technique is prolonged, another dose is given during the operation, intraoperative. There is no need to give prophylactic antibiotic after the surgical technique for prophylaxis, except if there is gross contamination like surgery on colon or rectum. Therefore, we give antibiotic 1 day after the operation, and actually this is called perioperative antibiotic because we give a dose of antibiotic before the operation, we give a dose of antibiotic during operation, and a dose 1 day after the operation. This is called perioperative antibiotic prophylaxis. The antibiotic prophylaxis give the tissue a high tissue level of antibiotic to prevent bacterial contamination and to prevent bacteria from getting a foothold when contamination occurs. In surgical sites infection, including post-operative wound infection, the incidence of this infection, surgical site infection and post-operative infection, is markedly decreased by antibiotic prophylaxis. If there is post-operative wound infection, post-operative wound infection can be classified into 2 stages. Early before pus formation. Early before pus formation, we give antibiotic. But if pus is formed, drainage by partial removal of sutures. Cefazolin. Cefazolin is a first generation cephalosporin. Cefazolin is a first generation cephalosporin. Can be considered as the best prophylactic antibiotic for gastroduodenal surgery, cardiovascular surgery, orthopedic surgery, or neurosurgery. Therefore, cefazolin which is a first generation cephalosporin, can be considered as the best antibiotic prophylaxis for all these conditions. You should notice that there is cross allergy between penicillin and cephalosporins, and if there is penicillin allergic patient, we can't give penicillin or cephalosporins, and in this case fluoroquinolone is the best alternative. Fluoroquinolone, this is a group of antibiotic. Example, ciprofloxacin belonging to this group, ciprofloxacin. Combination of cefazolin and metronidazole. Metronidazole is effective against anaerobic organism. Cefazolin and metronidazole is the best prophylaxis in colorectal surgery. But if there is penicillin allergic patient, we can't give him cefazolin. Therefore, we can replace cefazolin as usual by fluoroquinolone, which is ciprofloxacin. Or we can replace metronidazole by clindamycin. Clindamycin. The common colonic bacteria usually combination of and mixture of gram-negative bacilli and anaerobes. Gram-negative bacilli and anaerobes. This is very important. Why? For pre-operative preparation of the colon for colonic or rectal surgery. Pre-operative preparation in colon and rectal surgery usually by metronidazole, which is flagyl, in combination with neomycin, given orally 2 days before the operation. If we need prophylaxis, not colonic preparation, if we need perioperative antibiotic prophylaxis for colonic injury or colonic surgery, parenteral intravenous ciprofloxacin and flagyl is used. The course of antibiotic usually take about, for therapeutic, not prophylaxis. Therapeutic use of antibiotic usually take the duration of about 3 to 6 days, except if there is severe contamination, like what? Fecal peritonitis. In fecal peritonitis, the course of antibiotic is prolonged to 10 to 15 days. Bacteroids. Bacteroids are the commonest anaerobes in surgical practice. We met in surgical practice usually bacteroids as the commonest anaerobes. For sensitivity, bacteroids are very sensitive, and the anaerobes are very sensitive for metronidazole or clindamycin, or less effectively ampicillin or amoxicillin. Metronidazole is the commonly used for anaerobes, and the example for anaerobes is bacteroids. And Pseudomonas aeruginosa. Pseudomonas aeruginosa is aerobic gram-negative bacilli, usually cause many nosocomial infections. Many nosocomial infections are due to Pseudomonas aeruginosa. This organism produce UT infection, pneumonia, septicemia, and produce green pus. This is very important MCQ. This organism is famous with resistance to antibiotic, and it may acquire resistance during the course of the antibiotic. The best for this organism is combination of antibiotic between one of quinolones group, ciprofloxacin, or carbabinins. Example, imibenem. or third generation cephalosporins, or amino or aminoglycosides, example gentamicin. We use usually combination between any two of these antibiotics. In general, aminoglycosides is not recommended to use for long duration and should be avoided as much as possible. Why? Because this group is famous in ototoxicity and nephrotoxicity. And during the course of aminoglycosides, repeated estimation of serum creatinine and the blood urea is recommended to avoid nephrotoxicity. In penicillin allergic patient usually have allergy to cephalosporins, and the alternative for both penicillin and cephalosporins is erythromycin. Clavulanic acid is a beta lactamase inhibitor. Lactamase inhibitor is enzyme beta lactamase is secreted by many organisms, which leading to inhibition of the effect and resistance to the effect of antibiotics. If we give this antibiotic, clavulanic acid, in addition to amoxicillin, this will increase the spectrum of effect of both antibiotics. The commonest UT infection is Escherichia coli, and this organism is sensitive for citrine, bactrim, nitrofurantoin is a group. Nitrofurantoin is a group of antibiotic like macrobid or quinolones, which the typical example is ciprofloxacin. The commonest organism in biliary infection is Escherichia coli and Klebsiella, and these organisms are sensitive to the following antibiotic: methicillin, piperacillin, combination of ampicillin and aminoglycosides, or cefazolin or ciprofloxacin. The main organism responsible for Clostridia of gas gangrene is Clostridia molchii, which is nowadays called Clostridium perfringens. Clostridium perfringens. Nasal carrier of Staph aureus. Nasal carriers of Staph aureus will give Staph aureus in the air, leading to droplet infection by this organism or contamination of wounds by this organism in nosocomial infections. Eradication of this carrier state in the hospital staff will markedly decrease the incidence of infection with Staphylococcus aureus. Staphylococcus aureus and streptococci are very sensitive to cephalosporins, cefazolin, amoxicillin, or erythromycin. Oral bacterial flora, strains of staph and strep and anaerobes, especially bacteroids. Granulicatella, Gemella, Veonella, Lactobacilli, Corynebacteria. This is the commonest oral organism. And the commonest cutaneous organism, strains of staph and strep, Enterobacter, Klebsiella, E. coli, and Antibiotics. Well, we should know these organisms. In many MCQ questions, there is a history of human bite, and after many days, infection in this site occur, and the MCQ asks you about the susceptible organism for infection due to human bite, either from the oral bacterial flora or from the cutaneous bacterial flora. And in most questions related to staph and strep is the solution of this organism. In severe infections, fatal infections, like what? Septic shock, acute generalized septic peritonitis. The initial antibiotics will give combination of cephalosporins. Typical example, as we know before, cefazolin and one of the aminoglycosides like gentamicin and metronidazole for the anaerobes. These three antibiotics actually cover all organisms, and later on we can change the antibiotic according to culture and sensitivity, but the initial antibiotic given in this fatal condition, acute generalized septic peritonitis and septic shock, combination of cephalosporins, one of the aminoglycosides like gentamicin, or we give also metronidazole. This covers all organisms. What are the complications of antibiotic? First of all, hypersensitivity, which is very common, related to penicillin and streptomycin. And if you have sensitivity to penicillin, this suggesting also sensitivity to cephalosporins. Hypersensitivity reaction range from slight urticaria to fever to angioneurotic edema to asthma to anaphylactic shock. Vitamin B deficiency due to changes in the intestinal flora due to prolonged use of antibiotics. Specific toxicity like aminoglycosides, nephrotoxicity, and ototoxicity may occur. Super added infection with much more serious organism. In organism resistant to antibiotic like Proteus, Pseudomonas, Candida, and this lead to infections in the mouth, intestine, urinary tract, or lung. This is the important points related to antibiotics. Thank you for good listening. and good luck.